Hi, thank you for tuning in to Global Elite Consultant, brought to you by Global Elite Academy. If you have any questions, you could call us. Go to globaleliteacademy.net. Look up our phone number and give us a call. Now, today we're going to do opening up a non-medical home health agency in North Dakota. Now, I'm sorry, home health agency is a skilled agency. So we're going to talk about non-medical agency. You do need a license for skilled or non-medical. North Dakota requires that you have a license. So you have to fill out the application and show the proper documents for a non-medical agency. Okay. You have to set up the structure of your business. If you're going to be a LLC, a corporation, or what are you going to be? It looks like it's $135 are the standard filing fees for to set up the structure of your business. You want to go to irs.gov to get your EIN number. You can get it right away as soon as you fill out the application on the website. So, in North Dakota, all home care agencies must obtain a license from the Department of Health and Human Services. This applies to both non-medical and medical home care agencies. So you're going to submit your application, any documents that they, require. You're going to do a background. They want you to also show your financial stability, meaning how how you're going to run this business, and also a background check. You're going to have to do a background check. Okay, you have to develop your policy and procedure manuals like always. You give us a call and we will help you. We'll do the policy and procedure manual for you and you can purchase it from us. So go to a globaleliteacademy.net. And it might be an application there letting us know that you want to do a policy and procedure and what state you want to do it for. If it's not, just give us a call. We'll tell you what form to fill out on our website. Okay. You're gonna have to hire your supportive team from your office. For your, the office, you don't need an RN or an LPN. You need somebody who to run an administrator with at least 2 years experience. And you can verify that with the state. I'm saying 2 years because it's usually 2 years. Everywhere it's usually 2 years, but we could verify that with the state. Your caregivers need to have at least 1 year experience, and they need to have ongoing training, which means once a year you still provide additional training for your caregivers. Okay. Like always, you have to market it your service. If you don't market, who knows you're there? It's really, when I first started doing this, I was really shocked how people weren't even marketing their business. I guess they were just thinking they're going to open up a business and then they don't have to do any marketing. But how do you think you're going to get patients if you don't market? And who even know you have an agency if you don't market and tell people that you're there? You have to market. So make sure you put some marketing money aside. Okay. Um, okay, so let's see what else you need to open up this home health agency in North Dakota. So after you fill out your application, then somebody will be out. They will come out and do a survey. And so what they really want to do is make sure you have your policy and procedure manual. That's what they really want. And they, probably inspect where you're gonna, have it at. A lot of people will open up the home health agency, non-medical, in their home. They'll have a home office, and that's fine. You could do that. You don't have to have a facility. For skilled nursing, I would think that you would have to have an office because you're going to have PT and OT, and they need to maybe step by the office and get their supplies or stuff like that. But for non-medical, you're not really going to need that because usually the family supplies all of the supplies. So you could just do it like, from your home. And then you're going to have to do a background check, I'm sure. After you do your background check, fill out the application. However much it costs, you're going to have to pay the state that money directly. Getting your EIN number, which is employee identification number. Then you're ready for the background check. So you'll have to do the background check, the administrator and the owner. And if you are the administrator and the owner, then you would have to do the background check. After you've done the background check, then they'll send you a date as to when they're coming out for the survey. Once they come out for the survey, then you're going to be, they're going to approve you or deny you. It's always good, and these new agencies don't do that, but it's always good to have an accreditation from a accreditation company. Now, usually those accreditations are really expensive. So you might want to look into it, before you open. But you might actually do the accreditation like after you start getting customers. You might want to do your accreditation then. It just gives you more recognition and validation to your company. And clients definitely trust your agency more when you obtain accreditation. Being a non-medical, you still can obtain the Medicare certification. It's not required, but you could get additional patients, like 3 or usually 4-hour patients. They're usually 4-hour patients. You might have some 2 hours, but usually they're 4. And we'll talk. And now for the IHSS program that they offer. That program is for low income people who can't afford to pay for home care, so Medicaid pay for them. It's a home-based community program. And Medicare pays for it, but it's not a Medicare program. It's a community-based program. So I usually do a separate video on that one. And then I'll give you requirements for the IHSS. But that's all you need to open up an agency in North Dakota. North Dakota used to be an unregulated state, so I guess they've changed that because it says here that no matter what type of agency, you have to get licensed. And they have non-medical, and you also can open up an agency there for private duty, which is the same as non-medical. It's really the same. but it's just called, private duty. So you can either call it private duty or non-medical, but the requirements is the same. You still have to get the license. All right. So if you have any questions, you could put it in the comments, and I'll go in there and answer your questions, and then address it on a follow-up video. Thank you so much for tuning in to the Global Elite Consultant.